Coming to the types of bandage, Susruta Acharya explained in Sutrasthana 18th chapter, Kosha, Dama, Swastika, Anuvelida, Pradoli, Mandala, Stagiga, Emaga, Katwa, China, Vibandha, Vidhana, Gofana, Panjangi. And Vagbada Acharya included Ulsangi Bandha as the 15th Bandha. Charaka Acharya divides the Bandha into two, that is Vama and Dakshina. Actually, when coming to the roles of bandage, it is explained like this: the bandage should be from inward to outward. Bandage should be from medial to lateral. So that if we are bandaging to a patient's right hand, then it from medial to lateral like this. And when it comes to left hand, medial to lateral will be just opposite. And this is the basic division told by Acharya Charaka. This is Dvida Bandha, Vama and Dakshina. Coming to specific bandages of Susruta Acharya, Kosham is Kosham Angushtanguli Parvasu. We are using this particular bandage in interphalangeal subluxation or dislocation and fracture of fingers. Actually, this is Kosha Bandha. For this purpose, it is better to go for orthosis. I will explain orthosis later. In this condition, compressed cotton or top band, soft cotton. Mainly, we are using this for casting. Actually, this is Kosha Bandha. We can use a finger cord or frog splint instead of this particular bandage. Never use other finger as a splint. If there is injury to this particular finger, never use this finger as a splint. Two skin surfaces should not be bandaged together. We can use just a piece of cotton covered by a gauze in this particular area. But that technique is not much good. Why? Because if there is injury to this particular finger, after 1 or 2 weeks, this is very important. In fingers, maximum 2 weeks immobilization is only to be needed. After 2 weeks, you should definitely ask the patient to do rehabilitation in fingers. As fingers are more mobile, the rehabilitation is very important. The functional outcome is very important. So that ask the patient to do the rehabilitation even after 2 weeks, even if there is pain and tenderness. Ask the patient to do the rehabilitation to retain or to maintain the movements. If we are using the other finger, then we should do rehabilitation to that particular finger also. That particular finger is normal finger. If we are using that particular finger for bandaging, then we want to rehabilitate that particular finger also. So that this is a basic principle. Never use the second finger as a splint. It is better in this particular condition. Actually, this is Kosha Bandha. It is better to go for finger cord in this particular condition. In such conditions, in some conditions, in mallet finger, I will explain that. In mallet finger, mallet splint is better. Why? Because 6 weeks immobilization is needed. In mallet finger, only these 2 joints are immobilized. Up to here, the patient can move. This particular part is only immobilized. So that such orthosis are very effective, better than bandage. Coming to Dama, Dama Sambade Ange or Sangade Ange. The Sambade Ange, the Tika is Sangade Ange. And I will tell you what is actually Dama. I will tell you after explaining the Swastika Bandha. I will tell you what is Dama Bandha. Swastika is, all of us know, Sandhi Gurchaka Brostanandara Talakarneshu Swastika, figure of 8 bandage. The bandage which we are doing to a joint is Swastika Bandha. And this Anuvelidam is spiral bandage which we are doing in limbs. Shahaso Anuvelidam. Shahaso Anuvelidam. I will show the video of Anuvelida Bandha. It is we are doing in limbs. And Muttoli or Pradoli, Griva Matreo Muttoli. Muttoli and Pradoli are synonymous. Griva Matreo Muttoli. And actually the cervical collar is an improvisation of Muttoli Bandha. Muttoli Bandha, we can do Muttoli Bandha like this. I didn't took video of that, but I will explain what is Muttoli Bandha. We can take circular coverings of cotton with top band or compressed cotton around the neck. Circular turns, 3 circular turns. And then we can place a splint over the both lateral side of height this much. We can place both lateral side splints, 2 side splints like this above the cotton. And then circular turn with gauze can be applied. And then circular turn with gauze can be applied. After applying this circular turn, then it functions as a cervical collar. It will prevent the movement of the cervical spine. Regarding Muttoli Bandha, Actually, Mutoli bandha is, we are applying on Griva, and actually it's an improvisation of, the cervical collar is an improvisation of Mutoli or Pradoli bandha. And coming to the orthosis, usage of cervical collar or lumbosacral corset, this is very important. It should be only used at the initial phase, in the acute phase. After the acute phase, after when pain subsides, it must be removed. If we are advising on orthosis to a patient, it is very important to advise the patient in the very beginning itself when to avoid this particular orthosis. Otherwise, when you apply one orthosis, even kneecap or cervical collar or lumbosacral corset to a patient in the acute phase, then ask the patient to come after 1 week. The patient didn't come or doesn't come after when pain subsides, then the patient continuously uses this particular orthosis for 1 year or 2 years. It causes wasting to the muscles. Actually, the pathology will increase. Whenever that patient goes to other doctor, that patient will explain that doctor gave me this orthosis. So that advise the patient to remove the orthosis, to avoid the orthosis after the acute phase. This is very important while we are advising orthosis. This is actually Mutoli bandha. Coming to Swastika bandha, this is a hip spica bandage. Here you can see hip spica bandage. This can be incorporated in injury, transverse process injury, and also it can be given in spinous process injury of lower back, and in acute phase of low back strain, or in acute phase of sacroiliac ligament sprain. In such conditions, acute phase of disc prolapse, whenever there is acute low back pain, in such conditions also, to give rest, we can give this bandage. This is very effective. This particular bandage is very effective. This can be removed after a period of 3 days to 7 days. This bandage is better than lumbosacral corset. If it's a fracture, we can use Murivanna also over the affected part. Regarding transverse process is situated totally 5 cm lateral to spinous process. We already discussed this in the spine class. And we can palpate that particular transverse process and feel the tenderness, and we can identify the fracture and advise the patient to take X-ray. In such conditions, this particular bandage is very effective. This is hip spica bandage. We are taking 2 circular turns over the trunk and then 2 circular turns over the one hip towards one hip and thigh. We are taking 2 circular turns. This is actually Swastika bandha or hip spica bandage. This safety pin is to avoid inward rolling of the bandage. To avoid inward rolling of the bandage, we are giving safety pin. This should be removed in 3rd day or 7th day as per the condition of the patient. The first thing regarding this bandage is it should be inside the dressings. It should be done inside the dressings. After undressing the patient, we are giving this bandage. This is actually hip spica bandage or Swastika bandha. If we are doing this particular bandage to both legs, then it's Dama bandha. If we are giving this particular bandage to both legs, then it is Dama bandha. In bilateral perthus disease, we are giving Dama bandha. In Dama bandha, what we are doing is 2 circular turns over the trunk, 2 circular turns over one thigh, and 2 circular turns over the other thigh also. Actually, when we are doing this particular bandage, then it's called as Dama bandha. This is Swastika bandha or hip spica bandage. It is taken only to one leg. If there is radiating pain to one leg, that particular leg is immobilized like this. Second thing, if we are covering both hips or both thighs with this trunk bandage, then it's called as Dama bandha. Dama bandha is doing in bilateral perthus disease, Sangade Ange or Sambade Ange. That is Dama bandha. This is Swastika bandha. This is Swastika bandha of knee joint. Swastika bandha of knee joint. Actually, this particular material is called as muff. This is very soft. This is muff. Knee bandage should be done in knee flexion. 5 to 20 degree flexion is needed. 5 to 20 degree flexion is needed. This is functional position. Coming to shoulder, a slight abduction is needed. In metacarpophalangeal joint, we are giving this particular position. This is James position. In ankle fracture, or if we are bandaging to the ankle joint, then it is kept in dorsiflexed position, and second toe should be towards tibial tuberosity. And we will explain all this in that particular area of bandaging. We are seeing this shoulder bandage, then ankle bandage, or we will discuss. This is also, we apply muff. Regarding the application of muff, actually this muff should be covered 3 covers over the proximal and distal areas. Over the proximal area and distal area, 3 turns are needed, and in bony points also 3 turns are needed regarding muff, or sorry, not muff, regarding compressed cotton. Regarding compressed cotton or top band, it should be covered 3 turns on the proximal and distal, and in all other areas 2 turns are needed. In bony points also 3 turns are needed. In this particular bandage, I am giving a twist over the medial, lateral, inferior and superior aspect of patella. In this particular bandage, in knee bandage, I am giving a twist over the, this is inferior twist. Here you can see. This particular twist is given on medial aspect, lateral aspect, inferior aspect and superior aspect of patella. That particular twisting is giving more firmness or more power to the bandage, give more immobilization to the affected joint. Regarding knee joint, you can use a twisting over the medial, lateral, inferior and superior position. We are taking 4 tails to immobilize over the proximal and distal part of patella. This particular mobilization, we are tying the knot over the proximal and distal aspect of patella. Proximal aspect of patella and distal aspect of patella. In all bandage, first we are applying a gauze or muff to avoid cotton allergy. To avoid cotton allergy, we are applying either in, if we are doing POP cast, we are applying a stockinette. Otherwise, in simple bandages, we can use a gauze piece or muff and then cotton is applied. Here we are tying on the proximal aspect of patella, and then this second is tied over the distal aspect of patella. This is also Swastika bandha or figure of 8 bandage.